Hi, everyone. This is Caroline from Fiat Integrative Health in Franklin, Tennessee, and you're listening to the Fiat Health Podcast. We believe that now more than ever, the healthcare industry has become a place of confusion. And over the years, we have been asked countless questions about what true health and integration for the whole person looks like. Join us every other week as we explore topics ranging from primary care and women's health to counseling and spiritual health. We're so glad you're here. Hey, everybody. Welcome back to the Fiat Health Podcast. My name is Caroline. I'm a family nurse practitioner and co-founder of Fiat Integrative Health here in Franklin, Tennessee. And today I am joined by Ashlynn, one of our other family nurse practitioners. I'm really excited about today's episode because we are going to talk all about newborns. This is the perfect refresher if you're having a second, third, fourth baby, and then really prime for anybody who's expecting their first child.
Yes.
And Ashlynn is pregnant with her first baby.
So
exciting. And one of the amazing women who helps us put this podcast out there, she sends the emails and puts everything together for us, is also due with a baby literally any day. Mm-hmm. Just super excited to do this for her too.
Yay. Very timely.
Yeah. And so I've had 6 babies. So I definitely speak from a lot of personal experience as we go through this, but also professional, having seen countless number of newborns in the office. So we're specifically talking about the first 6 to 8 weeks of life. That is the newborn period. I would even argue 3 months. I always tell parents, but when you hit that 3-month mark, you are coming out of this
haze.
Exactly. Haze of what just happened. Yeah. So I am like really, really strong on like, give yourself a lot of grace for the first 3 months. You know, you're not going to feel like there's any routine. You're still going to be questioning, are you hungry? Are you tired? What the heck is going on for those first 3 months? So I'll just start with that. First thing is that maybe Ashlynn, you can tell us what we tell every newborn parent. This is a non-negotiable. These are the things that are like really important for parents to know coming out of having a baby.
Yeah. So 2 big things, which are great for new parents, but also a good reminder for, parents of multiples, is that a temperature over 100.5 in a newborn is an emergency. You need to go, call your PCP, go to the emergency room, and never leave your baby in the car seat.
Exactly.
Those are the 2, baseline.
Yeah. So if your baby it's not like you can't put them in a car seat.
Right.
But we don't want to have extended periods of time in the car seat unnecessarily, especially when they're out of that base where the base, is designed to keep them at a particular angle. And those carrier car seats, when you set them on a table or on the floor, they're at a different angle than when they're in the base. And obviously newborn babies are super floppy. And so they just don't have that head control. And so I know it's so hard when your baby's sleeping perfectly in their car seat, but please, please, please take them out of their car seat whenever you get somewhere.
Yep.
For that first, again, 6 to 8 weeks. And same thing with the fever. Once we get to that 2 to 3 month mark, we're out of that really fragile age and stage where fevers are an emergency. Mm-hmm. Okay, so I broke this up. To me, the 3 essential ingredients to a newborn. The only thing you need to know is eat, poop, sleep. Your entire life is consumed by this baby's eating, pooping, and sleeping. So that's how we're going to go through it. We're going to start with eating. So tell me a little bit about how do we feed a baby, Ashlynn?
Yep. So, obviously we can breastfeed, formula feed. Some parents do one, the other. Some parents do a combination. So whatever works for you and your baby. But when we're talking feeding, it's important to talk about hunger cues, which might be hard, in those first few days to weeks. It can be difficult to tell when your baby is hungry. Some babies have higher suck needs, which just means they seem like they're hungry all the time, but they just need to suck. And so it can be frustrating in those first couple of days, not knowing your own baby's hunger cues. Every baby is going to differ. There's some things that you can look out for, like sucking on their hands, rooting, breathing fast, moving their head from side to side, and of course, crying. Baby's crying. You can try and feed. Maybe they're hungry. But every baby's different. And, even me as your primary care provider, I don't know your baby's cues. You will learn them eventually. I'm sure all 6 of your kids had very different feeding cues.
Yes.
So
yeah,
that's just something you'll have to learn.
Yeah, our first baby was very much a high suck need baby. And I kind of went into it, obviously blind. And she was the kind of baby that was just fussy. She was a fussy baby. And you don't kind of realize it in the moment a lot of times because you just don't know anything else, especially with your first baby. And I would feed her and then she'd be screaming or, crying in an hour or whatever. I'd try feeding her again and she'd get really pissed off if I tried to feed her.
Yeah.
And it was, again, she just wanted to suck. And so anytime milk came out, she was like, what are you doing to me? But it took a lot of crying from both of us to figure out what to do. And I would say, too, we're going to talk a little bit about breastfeeding, formula feeding, but, getting hooked up with a lactation consultant, I think is an invaluable tool, especially with your first baby. For me, breastfeeding did end up coming very easily. Like we didn't run into issues. And I had no idea how many issues there are with breastfeeding until I became a primary care provider and see just the gamut of things that can come up. And it's like if you can be on the front end of that with having an established relationship with a lactation consultant, I mean, it is just so invaluable in my opinion to a successful breastfeeding
you don't know
journey.
What you don't know. And even if you've had multiple babies, every baby can be different.
Oh yeah.
I saw a patient yesterday. It's their second baby. They're having difficulty feeding. They just got missed in the hospital. Like lactation just couldn't stop by in their stay. And, she's just, well, I already have a baby. I'll figure it out. And I'm like, what? There's resources out there that you should utilize. So yeah, always important.
Yeah. And it's like, a lot of times things in the hospital, they're like, oh, everything looks great, and then things start not being so great at home. And there's just, we could do, and maybe one day we will do a whole podcast on breastfeeding. I absolutely never guilt or shame anyone who can't breastfeed or, their journey leads somewhere different, but there are undeniable advantages to breastfeeding for the mother and the baby. And so if we can do everything we can to make that journey successful, we are going to do it.
Totally.
So tell me, what is breastfeeding like, Ashlynn?
Well, I'll find out. But with my patients, it's important to remember that it can take a few days for your milk to come in after you have your baby. So somewhere around that 2 to 5 day mark is when your milk will come in. But the first few days, your baby is still getting fed. That colostrum is what comes first. And so that's what your newborn is getting calories from. So that's thick and yellow, and then it'll transition to a thinner, white, yellowy milk. But you'll know when your milk comes in. You feel really engorged, not comfortable. And so when we're talking feeding a newborn, usually we're feeding anywhere from 10 to 12 times per day, which is about every 2 to 3 hours, especially during the day. At night, we really don't want you going past that 4-hour mark. To still keeping your routine to 2 to 3 hours in the beginning is really important because you can't overnurse, but you can undernurse, you can underfeed. So it's really important. And especially in those early days, your baby might not wake up at that 4-hour mark. So setting those alarms is going to be really important and a priority to ensure that we're getting those 10 to 12 feeds in every 2 to 3 hours.
And I think one point that people may not understand is because they're like, oh, but my baby's gaining great, but your supply heavily relies on the demand of the baby. And if we go longer, especially a 6-hour stretch, which I've never known a newborn to go 6 hours, but when we start even getting to that 3 and 4 month old, when you go longer than 6 hours, it's signaling to your body, I don't actually have to make as much milk. And so that's when we often see a drop in supply. And in the newborn phase, the milk is flowing, typically speaking.
Yeah.
Typically, there is an abundance of milk. Babies don't have to work very hard even. They just lay there often and the milk just pours out. Yeah. But we want to make sure our body learns how much milk to make. And so that's why it's important. Typically speaking, I'll tell my patients that once the baby has reached birth weight again, because it's typical for babies to lose up to 10% of their birth weight in the first 2 weeks of life and then get back to birth weight by 2 weeks old. So once they've reached birth weight, you don't have to set an alarm necessarily, but a baby's not going to typically go longer than 4 hours in that newborn phase. If they're consistently going more than 4 to 5 hours, then yes, I would be setting an alarm.
Yep.
Yeah. How long do we nurse for on each side? So this is kind of interesting because some babies will fall asleep at the breast. And so they're not really nursing, but they are actually expending calories. So it is, in my opinion, now a lactation consultant may come on and tell me something totally different, that, you feed for 15 to 20 minutes on one side, you offer the other breast for 5-10 minutes, all together, not going longer than about 30 minutes breastfeeding.
Right. Yep.
Yeah. And so again, a lot of that is more so because we don't want babies unnecessarily working, spending calories. And I think too, it just helps establish a pattern. Because otherwise, if you're doing 45-minute, an hour-long feeds, and then an hour later, you have to nurse again.
Do it all over again. Yeah.
You are going to be worn out if you continue that pattern for a long time. So just if the baby falls asleep, take the baby off, unlatch the baby, put them up on your chest, pat their back. They'll likely go back to sleep. And if not, that's okay.
A lot of parents ask, how do I know my baby's getting enough? Right. So ways that we gauge that in your newborn visits is weight gain, of course. And I know Caroline already mentioned that, it's normal for newborns to lose up to 10% of their body weight in the first few days of life. But once mom's milk comes in, newborns should be gaining about 1 to 2 ounces per day, and be back at that birth weight by 2 weeks. So that's kind of how we gauge it. And then we also use wet diapers. So tracking your baby's wet diapers, which we'll talk about a little later, and dirty diapers. We want to make sure they're pooping, which we talked about in the beginning, and peeing.
Absolutely.
So those are the 2 biggest indicators.
Great. Let's skip down to poop. Let's start talking about the good stuff. So newborn poop can be a little weird at first because newborns, when they come out of the womb, maybe even literally as they're coming out of the womb, have meconium. It's black and it's tarry and it's this weird looking stuff. That typically lasts about 2 to 3 days. So a great sign is when you start seeing transitional poop. So that means instead of black and tarry, we're seeing green poop, greenish, and then it's transitioning to yellow. That is a great indicator that milk is in. Would love to see that. And then 2, a lot of times in that newborn period, we're seeing a lot of frequent bowel movements. I love how surprised parents are. And they're like, oh my gosh, every time the baby feeds, baby poops.
It's a good sign.
Yes, exactly.
Yeah.
So breast milk poop, what does it typically look like?
It's usually yellow. Can be a little liquidy, yellow, soft, and seedy. It's usually seedy because that's that milk fat coming out in their stool. So that's what those little seeds are.
Yeah. And sometimes a couple of variations that you might see are if you see really foamy poop, then that tells us that the baby's probably getting a little bit too much fore milk and not enough hind milk. So something to seek out either a primary provider or lactation consultant for. Also green. So we're through this transitional period. Maybe you're 4-week-old, 6-week-old, and all of a sudden you see a green poop. That can come and go. Sometimes it's related to whatever mom ate. Sometimes it's just related to their little bodies encountering something and changing. So that can be totally normal as long as it goes back to yellow.
Right. And then just to touch on urine output, I know you mentioned this just briefly earlier, but a general rule of thumb is that babies should have as many wet diapers as days old for the first week. So they'll tell you in the hospital before you leave to track their diapers, but it is important because that's something that we're going to ask you about at your first visit. So, if we see you at day 5 of life, we want to make sure they've had 5 wet diapers in the last 24 hours. But after that first week, newborns should be having at least 6 to 7 wet diapers per day. Usually it's with every feed. So if you're feeding 7 to 10 times per day, they should have around that number of wet diapers.
Yep. Yeah. Easy to keep track of.
Yep. Exactly.
Awesome. And then in terms of what would be concerning, things that you want to call your primary care about would be obviously inadequate wet diapers. You're not seeing the number you're supposed to be seeing. If your stool is consistently green, especially in breastfed babies, stool can be green in formula-fed babies. That's completely different. Anytime you see mucus or blood in the stool, even when you see blood in stool in infants, it usually looks like flecks. So anything that looks like a fleck of blood in there, teeny tiny, then that tells us that there's probably some kind of an intolerance. Most typically it's dairy, but it can be other things as well. So definitely want to reach out. And a lot of people ask me about the mucus. They're like, what do you mean mucus? And I'm like, literally, it looks like you blew your nose.
Yeah.
It's clear and snot put in the diaper. Anytime an infant in that first 6 to 8 weeks doesn't have a bowel movement for more than 24 hours, absolutely you need to contact their primary care provider, even with breastfed babies. So don't rely on Google. I've had patients who are like, oh, I thought it was normal. But really, the baby actually wasn't gaining weight at all. What goes in must come out.
Yep.
And so please contact your provider if it's been more than 24 hours. And anytime a poop that's hard, totally that would be abnormal in this age group. Or most age groups, but especially in the newborn period.
Listen to our constipation podcast.
Yes. Okay, great. So we've done eat, poop, and then sleep. So let's talk about how little sleep we're going to be getting.
I know. Every baby's going to be different. I mean, some babies come out super sleepy and they just want to sleep, and you have to wake them to feed and keep them awake. That won't last forever, if that's the case that you're in. You're like, my baby won't stay awake to feed. And I'm like, just wait. They will. But some babies wake up every 30 minutes. It's hard to say. There's no magic routine. A lot of sleep professionals, newborn sleep professionals, are like, there's no such thing as a routine until you get to 3 months of age, at least. So, but just manage your expectations on that.
Absolutely.
Don't try and put your routine or your newborn into a sleep routine. It's just going to drive you crazy.
Yeah, that's typically what I've seen. If people are like, oh, I'm doing whatever, I don't know, mom's on call or taking care of babies or whatever. I mean, maybe it does work for some people. In my experience with many mothers, it adds more stress than help because you're trying to put a newborn on a routine that they're not compliant with. Every once in a while you get one that's like, oh yeah, you're following this exact pattern, all is well. But often it's not the case.
Yeah. So there, wake windows as a newborn, it's going to be different in those first 6 to 8 weeks for a lot of babies, but it can be normal for them to be awake, really only have 15 to 30 minute wake windows, and sleep for long, most of the majority of the day.
For sure.
Yeah. They can wake randomly throughout the day and night. As they get bigger in those first couple weeks, their caloric demand is going to increase. So they might, start cluster feeding or require more feeds. And it's very common for newborns to get their days and nights mixed up. So they'll be waking more frequently in the nighttime versus the day, which is hard.
Yeah. If you think about it, it's they're in your womb in this cozy environment, and you literally rocked them in the womb all day long by walking around and all your movement. And so they just slept peacefully all day. It was awesome.
They loved it.
And then at night, you may notice that they're having a party and kicking around, and they keep that same exact pattern when they come out of the womb.
Yeah.
So I know with a lot of my kids, I'd be like, oh my gosh, this kid is going crazy in my belly at 10 p.m. at night. And they were ready to party at 10 p.m. coming out.
Yeah. I have a lot of parents who at that 2-week visit, they're like, I don't know what's happening. We're both sleep deprived. What can we do? So what are some, just based off your experience as a mother too, that's very important, strategies for sleep survival, how to stay as sane as possible in those early weeks?
I always tell parents, I'm like, sleep deprivation is a strategy of torture in the military. So if you feel like you're going to die, it's accurate. That's absolutely true. So this is, for me, I don't know, I'm really big on finding ways for everybody to get a little bit of sleep. I found that if you can get a 3-hour stretch, you feel less like a zombie. If you can get 5 hours, that's you probably feel like a new person. But 5 hours is not realistic for the first couple months of life, at least. So what we do for me and my husband is that we take shifts. And so, I breastfeed, and that means that what will usually happen is around 7 o'clock, or whenever I've had a feeding for the baby, 7, 8, 9, something like that, do the feeding and hand the baby off and go to bed. Baby stays with dad, put the white noise machine on, put your earplugs in, whatever you have to do, the baby is fed and will be fine for 3 hours.
Right.
And so, then I'll sleep for 3 hours. My husband will get the baby to sleep in the next 2-3 hours and put the baby down next to me maybe, or fall asleep with the baby. And then I will get woken up whenever that is, 11, midnight, something like that. And then I would usually take the shift, so to speak, from midnight to 4 or 5 a.m. whatever it is. And then if it's been a really rough night, feed the baby in the morning at that 5 a.m. time, 6 a.m., pass the baby off. Get 3 hours. You can pump. I don't really recommend in the first 3 or 4 weeks to pump and necessarily do bottles unless just because we're establishing the supply, at least not on like a regular basis. You could do it, every once in a while. Do you want to introduce, if you want your baby to take a bottle, we do want to introduce it at some point in that time period, but we don't want to be doing like 2 bottles a day. It's just hard to establish a good supply doing that. I always laughed when people said, sleep when the baby sleeps. But does it make sense to like take shifts like that?
Oh, totally. I've had parents like that 2-week visit and I sat across from them and I was like, okay, we're not leaving here without a shift plan. Like you are working this shift, you are working this shift. And like they just needed that permission to do that because they were not.
Well, I think it's, especially with your first baby, you're like, we're both all in. Like, I love it. Like sweet parents, the husband wants to be there when the baby's awake.
Right.
And the wife is like, it's on me. This baby's got to be strapped to me 24/7.
Right.
And then you're all dying.
Then nobody's happy.
Everybody's miserable.
Yeah.
And so absolutely, like, we're like, okay, divide and conquer here, people. Like, we can do this.
Totally.
Yeah. My first baby was not a napper. So like, she literally would wake up like 30-minute naps till she was like 9 months old. So when it was like, sleep when the baby sleeps, you're like, please shut up.
Please don't tell me that.
Please don't tell me that. So absolutely, I find it so much more effective. And, you're a mom. Like, I'm like, I can't even relax. The baby's right here next to me. They're going to wake up any second now. Like, why do I even try and fall asleep? So it's just like, please take the baby for 3 hours and let me sleep. Your mom comes over, feed the baby, give her the baby.
Give her the baby. Yeah.
Mom, go have snuggles. I'm going to sleep. Don't wake me up for 3 hours. Awesome. Okay. So we I think covered all the essentials.
Yep.
Eat, poop, sleep. I hope people feel, empowered. I like to say the newborn period is not something that you can ever be fully prepared for.
Never.
You can't go around it. You can't go under it. You can't go over it. You got to go through it.
Yep.
There is no way around it. And even as for me, every subsequent baby is different. You think you know what you're doing, you absolutely are thrown for a loop. So we want to go through just a couple of frequently asked questions we get in the office. So just kind of random tidbits here and there. What are some things you commonly hear from parents, Ashlynn?
Yeah, a big one is like all the noises, the newborn noises. Grunting, snorty. Sometimes they can sound congested. You're like, oh, are they full of boogers? That newborn congestion can be very normal. But of course, if you're ever concerned, talk to your PCP about it.
Yep.
But the grunting, all very normal, even while asleep. Like some babies are very loud sleepers. And then things like sneezing and hiccups. Sometimes parents are worried that means they have allergies or, something wrong with their gut. But all those things are very, very normal in that newborn stage.
Yeah, I'd say like the snortiness is like, because they're like, oh, well, I tried sucking things out. There's nothing in there. Is definitely, the baby was in a moist environment for 9 months and now we're putting them out here in the dry air. Maybe it's winter and the heat's kicked on. Maybe it's summer and the air conditioning's on all the time. Like their little bodies are just getting used to a completely different environment and they're tiny. Like every little thing sounds like a lot, but really it's just that they're so little. It's a little over exaggerated. And I've definitely had babies that needed a little bit of saline and a little bit of suction most days and were like extra boogery, and others who were just noisy. It's totally normal. And definitely with the hiccups too, sometimes hiccups can be like, if you have a lot of hiccups and they're kind of over exaggerated, sometimes it can be a sign of reflux, but you're usually seeing a constellation of symptoms with that. And hiccups is just one thing. Commonly, you will have felt hiccups in the womb. And then you will feel that they will have hiccups at the exact same time outside of the womb. It's so funny.
Yeah.
My one son had hiccups every day at 9 p.m. It was like I could feel him hiccuping and he came out and it's like, oh my gosh, you're still hiccuping, at 9 p.m.
Yeah, that's funny.
It's so funny. Some of the common things we get asked a lot is rashes or just like skin things that go on with newborns. So what are some of the things that we commonly see?
Some newborns can come out with peeling skin, but that can be very normal, especially depending on their gestational age.
Right.
So that's kind of a dependent factor, but their skin can look really dry and peely, which is normal. They're adapting to their new environment, just like we talked about with the congestion.
And you don't have to do anything.
No. Some people want to bathe them and scrub it off. That will make it worse.
Yeah.
Yeah.
Or put oil on. I'm like, I mean, you can if you want, but you really don't have to.
Right. Baby acne is a big thing that people, comment about a lot, but can be very normal.
Yeah. It usually comes almost on the dot 3 weeks in.
Yeah.
Baby acne comes up. Again, I feel like there's all kinds of clickbait and stuff. It's just this will cure your baby acne and it'll clear their skin. I've never heard of anything that actually works, nor do I recommend using anything. It's just going to go away. It's going to go away probably in a couple weeks, and it's just the baby's reaction to, again, the environment, to the hormones. Exactly. I mean, all the things.
Yeah. And then, we have different skin conditions like stork bites or hemangiomas, birthmarks, things like that. They always should be evaluated by your primary care physician and monitored, but all can be very normal. Stork bites specifically, we sometimes see them on the forehead, on the back of the neck, on the butt, but they'll usually fade, usually by 6 to 9 months. They can hang around longer than that, but of course we want your PCP to evaluate those, but can be just a normal variation.
Totally. Yeah. And I think one thing too that I always I'm on high alert for in the first, I'd say 2 months of life is torticollis. I think it goes unnoticed a lot of times with primary care providers. And what torticollis is that you have a tightening of a muscle, a shoulder, your shoulder trapezoid, I believe, so that the baby's head will strongly prefer one side. And sometimes it can be really obvious when they're coming out of the womb, and it'll lead to breastfeeding difficulties on one side maybe, or it can be really subtle. And parents don't notice it, that when you're sleeping, they actually always just tilt their head to the right side, let's say. And that muscle has to really be worked on. You really have to do some exercises, or else you will get a flat head.
Right. Yeah. So we need to intervene on the earlier, the better, honestly. Especially when they're that little, the exercises are a little easier to do and you have a fidgeting, resistant baby.
And it's, we can do physical therapy for it. You can see a chiropractor for it. It's great. But it's something that if we can catch it early on, it's so easy to fix. And if you don't catch it early on, you end up having to put babies in helmets for months at a time. And it's just so hard. So the more we can be on top of it, the better.
Yeah, definitely. You're just trying to notice, like Caroline was saying, they're in their car seat and they're always looking over to their right shoulder or their left shoulder. And hopefully these are things that your PCP will also help you notice.
Yeah.
Right. But important to just keep those things in mind.
And I will say the newborn, we covered a fraction of newborn things. The newborn has so much that can happen, and that is normal. And it's always great to be partnered with a provider who can just be there for you in this time and kind of guide you through those things. And I'd say our job might as well be called the reassurers.
Yeah. Yeah.
We are here to reassure you of what's going on, and obviously if something is wrong, we intervene, of course.
Totally.
But I'd say a lot of what we do is reassuring parents. And so, do we miss anything? Anything else comes top of mind for newborns?
I don't think so. I just think, ask all the questions.
Yeah.
There's no stupid question when it comes to newborns. I'm sure even though I see lots of newborns every day, I'm sure I will have plenty of questions.
Gosh. Yes.
With my first child. So ask all the questions. And I think having a good relationship with your provider is really valuable.
Yeah. I think in that newborn, with the hormones everywhere.
Yeah.
Everywhere. And, we didn't even touch on postpartum depression, anxiety. Well, whole episode on that. Having a voice outside of your head.
Right.
That is not your spouse who's probably just semi-lost and wanting to love you and doesn't know what to say.
Right. And even not your mom or your mother-in-law or your best friend, right? A very neutral party that can help you work through those things.
Absolutely. Yeah. Because we can get deep in our heads.
Yeah.
And on Google and all the things in this in this time at 3 a.m. Nursing a baby. Oh my gosh, is this normal?
Yeah.
So anyways, I hope you guys feel really empowered from this, and I hope it's helpful. And it was great.
Yeah.
Really fun.
I know.
We'll see you next time.
Yeah. See ya.
Thanks for listening to this week's episode. To learn more, you can visit our website at fiathealth.org. If you enjoyed this episode and you'd like to help support the podcast, please subscribe to our show on your favorite podcast platform and leave us a review. This helps make the podcast easier to find. Lastly, if you'd like to reach out, ask a question, or suggest a topic for a future show, send us an email at media@fiathealth.org. God bless.